Do you believe it? Sometimes being too diligent with health checkups, too strictly following every medical instruction after age 70, is actually what shortens your lifespan instead of extending it. It sounds very contradictory and a bit paradoxical, right? But let us be honest with each other for a moment. How many times have you walked into a hospital feeling healthy and cheerful, but walked out carrying a stack of test results, a new prescription, and a heavy worry in your heart? You feel like your body is an old machine being taken into a repair shop, being inspected down to every screw, rather than a human being enjoying the golden years of life. The truth is, modern medicine is excellent at saving our lives, but sometimes it goes overboard in searching for problems that never needed to be found. In today's video, I will help you put down that burden. I will point out 6 extremely common medical tests, the things you have been doing every year as a routine, but top experts around the world now advise that you have the right to question, discuss, and even decline them after age 70. And most importantly, I will show you how to talk to your doctor so they will not only avoid feeling offended, but actually respect your wise decision. But hold on. Before we go into that list, I need you to adjust your mindset a little bit. We need to agree on one golden rule. It is the difference between lifespan and health span. After age 70, our goal is no longer trying to live 20 more years at any cost, even if it means lying in a hospital bed. The goal now is to live the next 10 or 15 years with true quality, with clarity, independence, and without pain caused by unnecessary medical interventions. There is a dangerous concept in medicine called the cascade effect. It begins very innocently. You take a test just for peace of mind. That test finds a tiny harmless spot, but because it is found, the doctor has to order a biopsy. The biopsy causes pain or infection. Then it leads to a minor surgery, then medications, then side effects. From someone who walked in perfectly healthy just for fun, you suddenly get pulled into a spiraling vortex of illness with no way out. That is the trap I want to help you avoid today. However, I must give you one extremely important warning to ensure your safety. This video is for people who feel healthy and are doing routine checkups, what medicine calls screening. If you are having unusual symptoms such as unexplained weight loss, blood in your stool, persistent pain, or feeling extremely fatigued, please turn off this video and see a doctor immediately. When the body speaks, we must listen. But if you are feeling well, eating well, sleeping well, and simply want to know which unnecessary tests you should say no to in order to live more peacefully, then welcome. This is exactly the video for you. Let us begin with the first test. The first name on this list, and perhaps also the biggest fear for anyone getting a health check, is colonoscopy. I know, just hearing this word makes many people shiver. Drinking liters of laxatives, running to the bathroom all night, and then lying on a cold table while a scope is inserted. No one likes that. So what is the myth here? It is the belief that you must endure this ordeal every 10 years for the rest of your life to catch cancer. We were taught that when the time comes, you must go, whether you are 75 or 80 years old. But medical truth tells a different story. The most reputable medical guidelines today, including the United States Preventive Services Task Force, advise that this screening should stop at age 75. Why is that? There are 2 main reasons. First, colorectal cancer is an extremely slow-growing cancer. It can take 10 to 15 years for a tiny polyp to turn into a dangerous cancer. Let us do a simple calculation. If you are 75 years old, have had colonoscopies regularly your entire life, and they have always been normal, the chance of you developing a dangerous tumor in the next 10 years is extremely low. Second, and this is something very few people tell you, at this age, the risks of the colonoscopy itself are higher than the risk of getting cancer. The process of drinking laxatives to clean the colon can cause severe dehydration and electrolyte imbalance, leading to falls or exhaustion in older adults. Not to mention the risks from anesthesia, or worse, the complication of bowel perforation during the procedure. In other words, we are risking our present health to search for a disease that may never have time to harm you. So what is the wise action? If you are over 75, have had a colonoscopy within the last 10 years, and the results were normal, you have every reason to say, stop. But I know the fear of not getting the test makes you uneasy. So here is the perfect alternative. Ask for a stool test that checks for hidden blood such as FIT or Cologuard. This is a non-invasive test. You collect the sample at home, send it in, and you are done. No laxatives, no anesthesia, no pain. It still helps you detect early warning signs safely. And here is the magic sentence for you to use when talking to your doctor at your next visit. Doctor, considering that all my previous colonoscopies were normal, and at my age I am very concerned about the complications of anesthesia and laxatives, could I switch to using a home stool test instead? A caring doctor will breathe a sigh of relief and agree with your reasonable request. We move on to the second test, mammograms. I know for many women getting a breast scan every year has become an unbreakable ritual. We are always taught that the earlier you detect it, the higher your chance of survival. And that is absolutely true when you are in your 40s or 50s. But the myth we need to break today is this: you must continue regular mammograms regardless of age, even when you are 75 or 80. What is the uncomfortable truth? After age 75, the benefits of mammograms begin to fade, while the risk of something called overdiagnosis skyrockets. Imagine this. At older ages, breast tissue changes, and many tumors appear in a hibernating form. They grow so slowly that if you leave them alone, they will never have enough time to harm you for the rest of your life. You will pass away from old age long before that tumor can do anything to you. But the X-ray machine cannot distinguish between a sleeping tumor and a dangerous one. When the machine detects a white spot, the medical cycle begins. You are called back, sent for a biopsy, and you lose sleep from worry. And if the result is cancer, even if it is a very mild type, the pressure to treat will come crashing down. Surgery, radiation, hormone medication. Just think about it. Is it worth it for an 80-year-old woman who already has heart disease or diabetes to endure exhausting radiation sessions just to destroy a tumor that would have never harmed her? That is when treatment reduces quality of life instead of protecting it. So what is the correct action? Major cancer organizations today recommend that the decision to screen after age 75 should be based on life expectancy and overall health. If you are in a wheelchair or struggling with severe chronic illness, feel free to stop screening. But saying no to machines does not mean abandoning your body. Continue to self-check at home. While showering, notice if there is any unusual lump, something you can clearly feel, or any unusual pain. And here is the question you should discuss with your doctor. Doctor, at my age, will detecting small, slow-growing tumors actually help me live longer? Or will the risks of overdiagnosis and treatment make me more exhausted? This question brings the conversation back to the real focus: your quality of life. We move on to the third test, the PSA test for prostate cancer screening. If women are haunted by mammograms, then we men lose sleep over the PSA number in our blood. The common myth is this: if your PSA is high, it means you have cancer, and if it is cancer, you must immediately undergo surgery or radiation to cut out the tumor. But the truth is much more complicated. PSA stands for prostate-specific antigen. The problem is this: it increases not only when you have cancer, it rises when you have inflammation, benign enlargement, which almost every man over 70 has, or even simply because you just rode a bicycle. More importantly, prostate cancer in older men is usually the tortoise type. It grows at an incredibly slow pace. Most men over 80 have cancer cells in their prostate, but they die with it, not because of it. So what is the price we pay if we treat too aggressively? When PSA is high, you will be sent for a biopsy, a painful procedure that easily causes infection. If cancer is found and you decide on surgery or radiation, you face a very high risk of urinary incontinence, having to wear adult diapers for life, and complete loss of sexual function. Ask yourself this: at age 75, do you want to trade your remaining peaceful years for a life tied to diapers and shame, just to treat a disease that may never kill you? So what is our course of action? Instead of rushing into intervention, discuss with your doctor the strategy called active surveillance. It means we still keep an eye on it but do not touch it unless it truly becomes aggressive. And here is the golden question to ask your doctor. Doctor, if a high PSA result leads to detecting a slow-growing type of cancer, do the benefits of treatment outweigh the risks of losing urinary control and sexual function at my age? Or should we simply monitor it? Remember this: the goal is to live healthy, not just to live long. We come to the fourth test, an issue that I bet 9 out of 10 older adults experience: getting an MRI when you have back pain. You wake up in the morning with a stiff back, or after gardening and bending down, you feel a sharp pain in your lower back. And our first instinct is often wanting the doctor to take a scan to see what is going on inside. The myth here is this: if it hurts, you must scan it, and the image will show the exact cause so it can be fixed. But the truth is much harsher. If you take 100 completely healthy people over 70 years old who have no back pain and send them for an MRI, I guarantee that most of them will receive results like disc degeneration, bone spurs, or spinal canal narrowing. Doctors call this the gray hair of the joints. It means everyone gets it when they age. It is a sign of natural aging, not a disease. But the problem is that when you see those scary images on the scan, you begin to panic. And from that fear, you easily agree to unnecessary interventions like spinal injections or even expensive surgeries, when in reality, that pain could disappear on its own with rest and physical therapy. So instead of rushing to get a scan, what is the wiser solution? Focus on function, not images. If you only have simple back pain, be patient with physical therapy, heat compresses, and gentle movement. You should only get an MRI when you have real red flag symptoms such as leg paralysis, loss of bladder control, or sudden unexplained weight loss. The question you should challenge your doctor with next time is this: Doctor, do I have only ordinary back pain or any dangerous signs like paralysis that require an MRI? If the scan only shows age-related degeneration, will the imaging actually change the current treatment plan? We arrive at the fifth test, a service that is being heavily advertised today: whole-body CT scans or lung screening for people who do not smoke. It is often marketed under glamorous names like comprehensive cancer screening packages or scanning the entire body for absolute peace of mind. It sounds appealing, right? Better to look for problems than to miss something. But the truth is this: this act of looking for problems often brings more trouble than peace of mind. This is the Pandora's box of medicine. When you scan the entire body of an older adult with high-resolution imaging, the machine will almost certainly find strange spots: a tiny dot in the lung, a small cyst in the kidney, or a faint shadow in the liver. Most of them are harmless scars of time. We call them incidental findings. But once they are seen, the doctor cannot ignore them. And then you are pulled into a new cycle. Every 3 months you go back for another scan, or you may even need a lung biopsy needle. You turn a peaceful old age into days filled with fear about things that were originally harmless. So what is the right action? The golden rule here is this. If you are not a long-term smoker, over 30 years, confidently refuse lung CT or whole-body CT scans. Do not spend your money to buy anxiety. Simply tell your doctor this. I do not have high-risk factors, and I do not want to fall into the risk of overdiagnosing harmless nodules. I choose not to take this test. And the final test, the key piece to complete today's list, is a very familiar issue. The cholesterol test and the preventive use of statin blood fat medications. I bet many of you watching this video have the habit of taking a cholesterol-lowering pill every night as a protective charm. We are obsessed with keeping our cholesterol numbers extremely low, as perfect as when we were young. The myth here is this. The lower the cholesterol, the better, and taking this medication is the best way to avoid a stroke, no matter how old you are. But medical truth after age 75 is very different. If you have never had heart disease or a stroke, which medicine calls primary prevention, then the link between high cholesterol and mortality at this age is no longer clear. On the contrary, the price you pay for this pill is very real. Statins commonly cause muscle pain, muscle weakness, and fatigue. Think about it. If the pill makes your test results look nicer but makes your legs weaker, makes you afraid to walk, more likely to fall, or too tired to enjoy time with your grandchildren, then is it not harming your quality of life? So what is the right action? I am not telling you to stop the medication on your own immediately, but you have the right to question its necessity. At your next follow-up visit, bring up this issue and discuss it openly with your doctor. Doctor, I feel muscle pain and weakness when taking this cholesterol medication. At my age, and since I have never had heart disease, is maintaining a low cholesterol number more important than keeping my muscles strong? Can we try lowering the dose or stopping the medication to see if my health improves? This is a courageous question, and it may help you regain a great deal of energy each day. So we have just exposed the 6 most common testing traps. But I know that when you enter the clinic and face a doctor in a white coat, hesitation can still make you hold back. To help you feel more confident, I want to give you the holy trinity of questions. Do not just listen for fun. I want you to take your phone and screenshot this right now, or write these 3 questions into your medical notebook. This will be the shield that protects you from any test recommendation you feel unsure about. Question number 1, about necessity. Doctor, will the result of this test actually change my current treatment plan, or will everything stay the same after doing it? This question helps eliminate tests that are done just for reassurance. Question number 2, about risks. If I decide not to take this test, what is the worst-case scenario that could happen? This helps you evaluate urgency. If the doctor says nothing serious, you know you are safe. Question number 3, about balance. At my age, are the risks of complications from the test higher than the benefits it provides? Always remember this. Doctors are experts in disease, but you are the expert of your own body and your own life. The combination of the doctor's knowledge and your active participation creates the most perfect healthcare plan. Finally, I want to tell you something from the bottom of my heart. Medicine exists to serve life, not to rule it. Our goal after age 70 is not to try to live forever, but to live the remaining years with the least fear and the most joy. Peace of mind is sometimes a medicine more precious than any pill. I hope the information today will help you let go of unnecessary medical burdens so you can enjoy life more fully. If you find this video helpful, please give me a like and share it with your loved ones, with the seniors who need to hear these words. Do not forget to click subscribe so we can continue walking together on the journey of living healthy and peacefully. Thank you for spending your precious time listening. I wish you strength, clarity, and the ability to take control of your own health. Goodbye, and see you again.